we're here today with Mark Toomey and Karen Kline, and I'll allow you both to introduce yourselves and how you fit in with the NDIS sphere and disability. So, Mark, who are you for those that don't know you?
Well, I used to be an IT specialist trotting around the world, and then my son had a brain hemorrhage. Then I became his sort of primary manager over the last 7 years. And so I've been doing battle with the NDIS on his behalf ever since. Lost my career, lost a lot of focus on everything else, but just had to keep going with the NDIS.
So have you, as part of that, also been doing caring as well for him?
Some, but mostly he was in hospital, cared for in hospital. He moved into a group home, so I had to fill in some gaps there. And then when COVID started, we moved him out into his own unit. And I haven't had to do any significant caring, but I've had to put in a hell of a lot of time to manage his supports and other aspects.
And why is that? Does that mean things like, are you talking about rostering and managing people, or are you dealing with the NDIS?
It's mostly dealing with the NDIS, but also dealing with providers. I think the NDIA expects that somewhere between the funding pool and the person who's allocated the fund, there's this cloud of magic that just organises everything. And, you know, if I was a younger man and say I lost my leg in an accident, I had a fall, I smashed my leg, it got gangrenous, it had to be taken off, but I kept my brain working. The funding package for that would work just fine because I could manage everything myself. But when you've got my son, Jeff, with an acquired brain injury, severe reductions in his cognitive function, severe reductions in his short-term memory, he can't manage his package.
Well, he's busy being disabled, isn't he?
Well, he is.
Yeah. So when you're talking about the burden of day-to-day care, you're talking about, do people turn up? If they turn up, will they know what they're doing? And the revolving door of strangers and all of that. But then on top of that, you're dealing with the administrative side.
All the administrative side and multiple plans that are just plain wrong, that don't work.
I also read that he'd been in hospital for quite some time before.
Almost 2 years. Well, 19 months. So, yeah, a long time. He had a very severe hemorrhage, and his brain injury is extremely significant. So it took 9 months for him to learn to walk. It took nearly a year for him to learn to eat, which is incredible. He was 35, 36, 37, and having to learn the very basics of life.
So, and the impact upon him from a stress point of view, does he feel that?
He does. He even today, when we've got a support provider covering 24/7 support, we can't anymore get decent support. The provider has gone the way of a lot of providers. It's focused on the money, not on the quality of service. We're working on changing that so that we actually directly employ the staff so that we can get the right staff. But they send him people who are not trained to support him. He has a car, he has a wheelchair accessible vehicle, but the support staff can't drive that until they've been trained on just transferring him into the car and so on. And they send us support people that have never seen him before. They sent to do an overnight sleepover shift with him, a young girl who hadn't been trained in anything and had never seen him before. That's just insane. So we have that to manage, as
But
well
that
as
is a very common story. And so
it's
I think it's quite ironical that we have safeguards. I
well,
don't know what their role is, who they're safeguarding, but it isn't the participant.
we've engaged safeguards on multiple occasions, and they make excuses for the providers.
So bearing in mind that the NDIS is a system to make supports accessible,
Mm-hmm.
my personal opinion, it is the most inaccessible thing that I have ever encountered in my life anywhere in the world.
I never had to deal with the pre-NDIS environment, so I don't know what it's like or what it was like, but I do know that the NDIS as it stands today, the entire system is just about catastrophically broken.
So he's basically had to have somebody who's, quite adept at managing complex environments and things. If you were traveling in an IT environment, you're managing all sorts of things.
Yeah,
So a lot of people don't have that.
a lot of people don't have that. I'm lucky that I don't have to put up with some other idiot incapable of managing his needs. That's one way of putting it. He's lucky that he's got me. I also employ somebody to do the minutiae on an ongoing basis. Doctor's appointments, dental appointments, the activities of the day, the plan for the day. What do you want to do today, Jeff? Get down into
they have buckets of funding for capacity building, yet no one has defined what that is. I've always thought that if they just got a big roll of butcher's paper and they did a customer pathway as to, we enter here, then this, then this, then this, then this, so that they understood their own flow and roles and who did what and when it was supposed to be done, because I don't think that anybody's actually sat down and done that. So you're a father and an NDIS volunteer administrator, but you're also developing with this class action, and you've got some other things going on there, which we'll come back to because that's important. So, Karen, who are you to people that don't know who you are?
Okay, I'm a lawyer and a disability advocate. I'm also a registered nurse.
Mm-hmm.
My role with the NDIA essentially has been very much concerned with adversarial battles in the AAT, a number of very high-profile cases. I have had a good experience with the new IER. That was a good outcome for the participant. But as far as NDIS appeals in the AAT, they're very adversarial.
Is that because they're complex cases and it's an adversarial client?
Well, what the NDIA historically do, in the old days, they used to have an early resolution team, and that was disbanded by the previous CEO. Now, I understand that may have been resurrected up to a point, but invariably, rather than use internal lawyers, they have contracts with a number of the big corporate law firms, and more often than not, they also engage counsel early on. And most of the participants, of course, cannot get legal representation at all.
So who is that participant? Explain the scenario for people that don't know anything about it. So you're on the NDIS.
Yes.
You go for a plan, you need X amount, and you don't get it. Is it people asking for yachts and hookers, or is that not the case?
No, well, that's a nonsense, of course. An example, one of my clients, severely visually impaired, asked for very reasonable home modifications to make his house, the back of his house, accessible so he could pursue his goals. And that was denied, and that's been an almighty battle, which is still ongoing.
Mm-hmm.
And the lawyer's fees would be quite astronomical because that particular case is now in the federal court. But yeah, so what invariably happens is you get knocked back, you have an internal review. 99% of the time, the internal review basically rubber stamps the original decision. So the only option then is to go to the AAT, which has been bogged down. It's not
Which
unusual.
is the Administrative
Appeals Tribunal. Yes, and because there are so many cases before the tribunal, although in recent times the current minister has managed to cut them down somewhat.
So you are basically taking the government to court.
Well, essentially, yeah, it's a government agency, essentially. And what I feel very strongly about, as do many others, I'm not alone, is I just think it's morally repugnant and repellent, to use the minister's words. He's used his exact words, to have an unrepresented participant with significant disabilities up against the big corporate law firms. We're talking, the Minter Allisons, the Ashursts, the Australian government solicitor, and more often than not now a barrister as well. And
so they're not going for the extras. You're talking about people who have gone to the AAT for things that they're fighting for their lives. Is that the case?
That's right.
Yeah.
Yes. Some of the cases, and Mark has got many examples. He could recite many horror stories, but some of the cases are really quite tragic. That these supports are absolutely vital. They're absolutely life-sustaining. They're absolutely
because I have
necessary.
to say that a lot of the stuff that we read in the media, and certainly a lot of the journalists that were at the press conference in Canberra that Bill Shorten was at on the 18th recently, basically rehashed the same question, and it's all the pizzazz stuff about oh, the NDIS cost blowout. Oh, this is terrible. Oh, it's all this money. And these disabled people are rolling around in the dough. And so when you assume people are going to the AAT, it's like, you think they're going for the 80-metre oyster yacht. So what I think that people need to understand that that disability hasn't touched their lives is we are talking about people who have not got continuous support. There's no continuity of care.
Yep.
There's a workforce failure. You're getting people that we've got who are glorified maids, male or female, attending people with high intensity needs who are totally unqualified. Who you've got people that there's a level of systemic incompetence across the system, which seems to be there's a bit here, bit there, and never the twain shall meet. They none of them know what they're doing. It's like having between the NDIA and the NDIS, it's like a couple of Schrodinger's cats. Nobody knows what the hell's going on.
That's exactly right.
And so then you've got people that are being left to sleep in their wheelchair overnight.
Absolutely.
Being left in their own excrement, who are not receiving the level of care that they need. Or I find it astonishing that when you do report fraud, I've had an answering machine. I don't know why they need a fraud task force, because when you contact them and tell them, they just seem totally disinterested. The answers that I've had back from Safeguards have been, well, they are an unregistered provider, and as an unregistered provider, they do not have to comply with practice standards. They only need to comply with the code of conduct, and they can charge what they like. I'm not saying it's all one way or the other, but in my particular experience, if somebody has charged $900,000 for a $500,000 plan, which happens in many different cases with many different kinds of providers, but how the hell do they not know that? So, I know people are saying robo-debt, but I'm saying, like, if you don't know that, and then you're saying that there are intelligent algorithms to do what exactly? I mean, that's my feel on that. I mean, how in the hell they don't seem to be able to manage their way out of a wet paper bag, and people are saying there are these artificial intelligence algorithms to do what?
They're focused on totally the wrong things. They have been for at least the last 4 or 5 years. They've been focused on the wrong things. They've been focused on the notion that the person with a disability is greedy. And they've been completely ignoring the fact that the people who run the service provider industry are the people who are greedy. So Jeff lived in a group home for 2.5 years. And I was constantly haranguing the group home about the lack of supports provided. Jeff is supposed to have somebody with him 24/7. The number of times that I went there and found Jeff wandering around in the grounds alone, and the number of times I was called because Jeff had fallen out of his wheelchair because he was alone and because he'd gotten a wheel over the side of a curb that shouldn't have been there, or into a hole in the ground that wasn't protected. That was ridiculous. This was a very large corporatized health provider that was sucking in the money and providing no service.
Yeah.
Or the very barest minimum of service.
The answer is not as simple as make registered or unregistered, and I think that it is workforce related. And we had this massive jobs summit, and I was quite disappointed in the sheer and utter waste of time that was. Utter waste of time.
Complete waste.
In my view, gross incompetence, reckless indifference. As far as AAT appeals are concerned, it's quite clear what the objective is to break the person, because the
so it's a deterrent.
The corporate law firms are not model litigants. You know, the model litigant.
What is a model litigant?
A model litigant is you should not take advantage of a person that lacks financial resources. You don't engage
so you mean
in delay.
Timing them out so that they run out of money.
You don't engage in delay tactics. You don't keep asking them to prove a matter the government is already aware of. But they do this deliberately, and it's not uncommon for a matter to be stuck in the AAT for 2 years, some even more. There are some 3 or 4 years. And they do that. The objective is to break them. The stress is extraordinary. Most of these people, you know, they can't get legal representation. If they're lucky enough to get an advocate, those advocates are usually non-legal. Some of them are very good, mind you. But
I advocate, but I am non-legal, so I generally
there are some
seek somebody like you to work as a
There are some very, very good non-legal advocates, but whether they're legal or non-legal advocates is just not enough of them.
The problem is that people don't understand the NDIS, and you find that when you take someone into hospital.
Yeah.
If they get any bowel care in the time that they're in there, if they manage to get a shower whilst they're in there, they're doing very damn well. They certainly don't like support staff coming in. I can't blame them with the general quality of support staff out there, which is why it would save a hell of a lot of money in the healthcare industry, and a hell of a lot of people wouldn't lose their highly casualised teams when they were in hospital if their staff were able to be in situ. But they've clearly got no understanding. If they think that you're casual staff for the hospital, or they think that you work for the NDIS directly, and then, you know, the social workers come in just in case things weren't messy enough, and let's just pay 52 card pickup with your plan and make a total mess.
So let's just tag a couple of things about the hospital system and our experience. So Jeff was in Caulfield Rehab Hospital when his plan came through. And only once he had a plan could we actually work on finding him a place to live, because that was a big challenge in its own right.
Because they won't take you.
That's right.
Because they don't allow you to back pay.
Yep. So the rehab hospital regarded Jeff as an overhead. He was finished his rehab treatment. So they weren't providing him with any physio or occupational therapy or speech therapy, even though he needed all of those.
Right, so that was the NDIS do that.
So the NDIS was given responsibility for funding all of that, but the hospital wouldn't allow the therapists to visit him in the hospital because they had a legal objection to somebody else treating an inpatient. That's mindless stupidity.
Or you'll have them speech therapists who has no disability experience see somebody cough and go, oh my God, let's make them nil bile mouth and take all of your medications away and see if you tank.
Yes, yes. So then Jeff had a fall due to his disability. He tried to do something that he couldn't, and his support worker wasn't doing the job. he had a fall and shattered his left hip. Unsurprising, he has quite severe osteoporosis as a result of lying in a hospital bed for 2 years.
Doesn't do them the best.
Doesn't
no.
do your bones the best. And so he was admitted to hospital in, I think it was March 2020, COVID. Hospital says, well, you're not even allowed to come in and support him while he's in the emergency department. We're going to rely on him to tell us all of his medical history. No, no, no. You can call the police if you want, but I'm coming in there to support him.
Yeah.
It just kept on going like that. Mindless stupidity in the health system. And I'm absolutely convinced that this is caused by lawyers who want to protect themselves
Risk
against
management.
liability. It's their risk management plan, which creates more risk than you could ever imagine when you were being a risk manager.
Well, there's no dignity of risk. There's all these wonderful flowery things that the NDIS has discussed in a vacuum, and they've not told any other government department.
Now, let me tell you about the AAT, the other side of it. Okay, so Karen mentioned the model litigant. There's actually government internal rules that define what a model litigant behaviour is for government, and all government agencies.
Is that a code of conduct, or is that different?
It's stronger than a code of conduct.
Right.
But all government agencies are required to abide by it. Unfortunately, only one entity can take action against breaches, and that's the Attorney General.
Okay.
Nobody else can take action against a breach of model litigant behaviour, and therefore model litigant breaches are not prosecuted. We're hoping that will change.
So who's our Attorney General at the moment?
Mark Dreyfus is our current AG, and he's making enormous changes along a very immense trajectory of change that's needed. I mean, his first big change has been to scrap the AAT because the AAT became corrupt.
Absolutely. So what happens now if you get a plan and
If you get a plan that is no good, you have to apply to go into the independent expert review. But if that hasn't got capacity, you still go into the AAT. Now, there's some really interesting things about going to the AAT. The AAT operates like a sort of a consultative court. Decisions that are made in the AAT are binding on the parties that are at the AAT, but sometimes the NDIA actually doesn't follow the decision anyway.
They're not bound to?
They are bound, but they still ignore the decision.
Okay.
But decisions that are made in the AAT do not set a legal precedent.
No, it's not a court.
Where everywhere else in if you go to court and we make something happens and we look at it and they say, oh well, that should be the case, absolutely. Thus it's been tested and becomes law. And
so there was a fairly famous AAT decision, the Castledine decision, that said that the NDIA had to take the advice of clinicians who know the person with the disability and do what the clinicians say. Now, constantly across the board, the NDIA refuses to follow the advice of clinicians and instead follows their own set of whatever rules, their incompetent rules.
So I thought so when you go on the NDIS and you're sort of working out what your plan's going to be, you have to go and get all these reports.
You do.
So who pays for those?
It depends on the time of what happens. Once you're in, the NDIA pays for them, But when you're entering,
Well,
you have to pay
but they
for
don't pay for any specialist reports, though, do they?
They pay for all
OT
sorts of
and
reports.
physio
Yeah,
and
they
things,
they pay for OT and physio reports and neuropsych reports, psychologists, psychiatrist reports. They pay for all of them. They pay thousands and thousands of dollars for these reports,
which have increased quite a lot, incidentally, since the NDIS was. Because I think an OT report pre-NDIS was around $500, and we're getting to what,
Yep.
$6 grand now?
Yep.
Is
That's
there a
right,
reason
several
for
grand.
that?
Yeah, it's because the NDIA just pays the bill, doesn't question. But the worst thing is that the NDIA then completely ignores the report.
Yeah. Can I just talk about the
Yeah.
issue of precedence? Yeah, the AAT decisions, because it's not a court, it's persuasive only. You need to get to the federal court level and higher for a decision to have legal precedence. And the problem with the AAT, first of all, a quarter of members are not legally trained at all. 40% of the current staff at the AAT are partisan political appointees.
What does that mean?
They're not chosen on merit. They had no selection process. And that's one of the things that is changing with the new agency, which will replace the AAT.
What you're saying is nepotism?
Yeah,
They put their mates there.
Yeah, it's basically, staff. The previous government, that linked with the previous government staff as failed candidates and the like.
Right.
There was no proper selection process. No merits interview committee or anything like that.
So they didn't have to have sort of lived or experience of
no,
disability.
nothing like that.
So most of them wouldn't understand the disabilities.
Yeah, and senior members. There are senior members making very important, complex decisions that don't have a single law subject to their name. They're not legally trained. And there's just no consistency with the decisions. They're all over the shop, aren't they? They don't.
Well,
that's why I make the joke about the chocolate wheel. That they must have a chocolate wheel in there. They just, somebody just goes, "I'll give it a spin," and they spin, and they go, "Yay! This one gets 24-hour care," and they spin it again. This one's going to the AAT, because there isn't a pattern that has made any sense to me.
There is a pattern, and an organisation called Queensland Access for Inclusion, QAI. It's a Queensland government-funded organisation. They did an analysis of AAT appeals, and something like 97% of appeals that actually get to a decision made by a member are successful for the applicant.
Yes, I'm aware of that report.
So this is saying that it might be a bit like a spinning wheel. So this is the old insurance thing
where the chap that comes out and says, like I know through the Queensland floods, there was somebody that I knew who didn't get paid out on the flood because their stormwater drainage wasn't working, where they try and pay. So being an insurance scheme, are they taking that absolutely literally and trying to pay as little as possible?
Well, that's one of the things that they're trying to do, yeah. And the AAT rules against them most of the time when it actually gets to an AAT decision. Not 97% of all of the cases that start, because something like 30% of them actually never get to a decision. It may even be more. They don't get to a decision because either the NDIA settles beforehand or the applicant drops out. The AAT has a very significant track record of settling right at the last minute, because they don't want a decision to be made on the record. There's no actual record of settlements that happen before the member has a hearing. But here's the nastiest bit. In the concept of the AAT and in the government's own guidelines, if the AAT decides consistently against the government agency is supposed to then refer the decision to the federal court so that it is tested in a court that can actually set a precedent. The NDIA, exactly the same as was happening with Robodebt, has been saying, okay, that one got through the member, but we won't get it tested in court because then it'll become a precedent and we'll have to do it all the time. So
So
it's,
what's a member? That's like
the member is the
that's like
AAT person.
right. That's your sort of like a judge type person.
That's right. Yes.
Okay.
Yeah. So there's literally thousands of decisions that have been made in the AAT that should have become precedent to control how the NDIA makes decisions about plans.
But that didn't happen.
They didn't happen.
So you're saying, Karen, that those members who are like a judge who are
Yes.
making these are not legally trained.
A quarter of them are not. And we're talking senior members.
So what are they trained in?
Well, they are basically political appointees. They've had, I won't mention names, but some of them are ex-Liberal MPs, staffers, people like that. It's very partisan political connections. And they're just not chosen on merit. And it hasn't always been that way, but certainly in the last few years.
I suppose when you're creating a whole new agency from nothing, I mean, you can understand that there must be a sort of like an almost force majeure into that direction of like, oh, this is going to be a new trough. Let's go.
AAT is not a new agency. It's been around for...
No, but for this particular purpose for the NDIS, I think it's probably been hammered more than, well, apart from Robo-Debt, of course.
Yeah, it's been hammered more, but AAT's been around for a long time, and it's been stacked politically
For how long
from the very beginning.
It's been very
30-odd years.
Yeah, it was a Labor government initiative, but in the last few years, particularly with the Morrison government, it was very, very stacked. 40%, very,
and what ramifications does that have?
I think it's open to you getting perverse decisions.
Yeah, and there are perverse decisions, but I guess the fascinating thing in the context of NDIS is that even though it was heavily stacked with Liberal Party appointees, they were still deciding against the government on a major portion of cases.
Yeah.
So, but there are some people in there that, come hell or high water, they were not going to decide against the government.
Okay.
Yeah, there's one member, she's gained some notoriety. The Attorney General's had a lot to say about her. Every decision that she's made, without exception, as a senior member, has to be to affirm the agency's decision. She never ever finds in favour of the applicant. And
so, what are the ramifications for people that? What have been some of the consequences for the people?
For the person with disability?
Yes.
The consequences of failing to get a decision changed are that you live your life underfunded and you can't do things that you should be able to do. We haven't taken any of Jeff's failed plans to the AAT because we've found ways of getting the plans fixed in other means without going there. You can, as a person with a plan, can ask the NDIA for a new plan after 9 months. So when they underfund Jeff's plans, they last for about 9 months with the level of support that he requires. So we just treat every annual plan as a 9-month plan and go back.
Well, that's one way of getting 25% more. That's
right.
Yeah.
But we still have to justify what we've spent. But there are
I'm
still
not saying
things.
that, but there are people that in the stories on your website.
Oh yeah.
Who have we're not talking about they can't do things. We're talking about people that have lost vision or have their lives have been shortened or even they've passed away without funding. I've seen these kinds of stories. It's not just a case of somebody not being able to get a fancy new wheelchair or 24-hour care with a nurse. We're talking about things that have a severe effect on people's lives.
Yeah, absolutely. I mean, we have listed on the website a mother who has an adult daughter where the adult daughter can't transfer, and the NDIA refused to provide a lifting machine. So the mother has to manhandle the daughter in and out of the bath every day. As a result, the mother now has a serious back injury that she'll never recover from. There are dozens and dozens and dozens of stories like this.
And this is why you are advocating for a class action.
It is. So I spent a long time looking at what people were posting on various Facebook communities about the NDIS and wishing that somebody would start a legal action, a class action, that I could join. As at that time, I was in a fairly parlous mental health state. I'm diagnosed with PTSD. 2 courses. One is long-time historical. The other is more recent, and it's spelled NDIS. So I've developed an add-on to my PTSD by having to battle the NDIS constantly. So I wasn't really inclined to try to start something myself. And then I got this message one day from this lawyer who said, somebody's got to do this. If you do the front work, I'll stand behind you and provide some legal input. So we created a Facebook group to drive towards a class action. That Facebook group's pretty hard to get into because you have to convince me that you have a really serious bad experience with the NDIS before you become a member. And that's to make it a safe place for people to talk about what's been happening to them. And the stories that they tell are absolutely appalling. We've got 488 members in that group now. 488 individual people who say that they personally, or the person with the disability that they support, have been harmed by the NDIA. And if you start to expand out what those networks mean, that means that we've got probably 3,000 to 4,000 people represented on that group. And we have a mother of twins. The twins have identical conditions, same underlying biological aspect that creates disabilities. The NDIA gave one twin a fully loaded plan, everything that was needed, and gave the other twin about 10% of that on the back of identical reports. Yeah. That mother is between a rock and a hard place. If she appeals,
she may lose
funding from the fully funded twin. And that's one of the conditions that people are battling against constantly. If we ask for a review, we might lose funding, not gain it.
I knew a woman who had 2 children with ASD, and they're both quite in need of quite a lot of care. And there are issues where they need robust housing. And so she has to rent a second house in order to put the other child. They're only sort of very, very young, and she's appealed for help. Well, they've got 2 entirely different plans. They're brothers, not twins. But, she was told, well, hand them over, like, to who? But there's nowhere for people with a disability to go without care. It's tailgate warranty. They dump them off at the hospital.
That's right. And it keeps on going. So we got this Facebook group going.
Yeah.
And we got quite a lot of people enrolling, and we started investigating the depth of the problem. Individual stories started off, and then we started looking at reports out of AAT appeals, and various other reports that have been prepared by diverse organisations, and it becomes very obvious very quickly that what people are experiencing is actually documented in a lot of these reports that, in my mind, constitute evidence, but courts may not see them as admissible evidence. So we're looking for ways to build a case. A barrister by this time has told us that we have to be able to prove that NDIS officers have committed misfeasance in public office.
And what does that mean?
That means that they do something that is unlawful with the knowledge that it is likely to be harmful, and that in the face of that knowledge, they recklessly continue to do it and cause harm.
Yeah, abuse of power, reckless indifference, orchestrated malice are some of the words used.
So this is very hard to prove. It's extremely hard to prove. Unless you have something like happened with Robodebt, where you have a very senior solicitor in the department standing up on a witness stand under oath, testifying that the solicitor told management that what they were doing was unlawful, and they went ahead and did it anyway. Now that's the crux of what happened with Robodebt. We know for a fact that exactly the same thing has happened in NDIA. We can't name people.
No, but what does that mean? That they've...
It means that the NDIA has proceeded to develop systems that work out what is going to go into a plan where those systems are unlawful.
Is that because they didn't have enough staff and they were trying to make up the difference with computer software?
That's not an excuse.
No, but I'm just trying to be devil's advocate.
Yeah. They might use that excuse, but it's not. It's not a valid excuse, regardless of...
Or is it because the rats jumped the ship to the next trough?
Oh, well, they were in the troughs on both sides anyway. There are people who were involved in Robodebt.
So how could you have been involved in Robodebt with all of that palaver that went on and still exist in that capacity doing that job somewhere else?
That's an extraordinary concept, isn't it? That you could have done something unlawful in one agency and done it again in another agency. The thing is that they were doing it at the same time. Right. So the Robodebt Royal Commission has documents that were tabled for the Commissioner that were instructions to people in the Robodebt space that were provided by people who worked in the NDIA because they were straddling the two camps. So the same people, literally by name, by passport number, were involved in both Robodebt and Robo-NDIS.
But with the Robodebt, that's all clean and clear now. That's all over, isn't it? All the debt collectors have been sent home. I mean, I personally would have been more excited if they said they're going to send all the solicitors home.
No, the report's due on the 30th of June, the Commissioner's report.
Yeah.
And we won't know until then.
But the word is there will be adverse findings against certain individuals, certain public servants. And the Minister Shorten, has said, and then we'll have to decide what we do with those public servants. You know, the expectation is there will be adverse findings in Commissioner Catherine Holmes' report.
And I haven't had a chance to go into it in depth yet, but in the last few days, the Prime Minister has announced that he's directing the Public Service Commission to take some actions to actually change the culture of the public service away from
it's been a standing joke for a few centuries, the old public service joke, isn't it?
The culture of the public service is appalling.
if you notice this notice, you've noticed this notice is not worth noticing, so don't notice the note. You know, all that bureaucracy stuff, you know, that's what one expects.
Now, the thing that intrigues me, okay, I finished school in 1972, and I could have taken either the matriculation exam or the public service exam. They ranked equally. I could have chosen to go into the public service if I could pass the high standard that the public service exam required. And that was the thing. To get into the public service, you had to be the best of the best of the best. Now,
so what
it's
are you
the
saying
last
public
place.
service is? When you go into services SA and it's the chick behind the counter, I mean, who are you implying?
Well,
is public
that's
service?
where everybody started their life, in the public service, at the front line, delivering service.
And an honourable occupation.
In an honourable occupation, and you worked your way up the tree. You had to do study, you had to do exams, you had to demonstrate that you were suitable for advancement to a higher level. None of that happens anymore. So people get into the public service without proper qualifications, and then they climb the ladder by brown-nosing.
Mark, do you think there should be a Royal Commission into the public service? Because that's been bandied around in recent times.
I would love there to be a public service.
Change the way that government works, make it more open and transparent. And
Absolutely.
I mean, FOI is broken, is it not?
FOI is broken, AAT is broken, NDIA is broken.
So what is an FOI?
Freedom of information. And
so when would somebody use an FOI?
FOI, you know, to find out, to obtain documents, file notes, conversations between various people. I'm involved in an FOI at the moment. And invariably, it's all concealment and, oh no, we won't reveal names. And it goes completely against the objects and principles.
So we're not talking about, you know, an official secrets act.
No,
or, you know, something
documents that pertain to yourself.
That's dangerous to the national security of the country.
Yeah,
we're talking about.
But you know, I mean, I received communication today actually from the Department.
But you're saying that you don't own your own data.
Yeah,
and you have to ask.
These documents that involve a matter I'm involved in, and they, you know, do have these it appears quite incriminating emails. But it appears they'll only think about giving them to me if they can blot out everybody's name of all the public servants involved. So their names, their email addresses, phone
and you're
numbers.
Quite sure there were no UFOs involved
Exactly.
or anything that they need to redact or nobody was...
And bear in mind, I was a legal practitioner involved in this particular case, and they say, no, you're not allowed to know anybody's names of any of these public servants.
And you have the permission of the other people who, you know, the data is about. They're happy. But
yeah, it's just extraordinary.
Because that's the thing, isn't it? So when you get a no-caller ID, I mean, you could either be a scammer or it could be some sort of public service organisation, couldn't it? So you never really know when you're to answer the phone at the moment. I mean, a lot of us don't have landlines anymore after the NBN anyway. We gave up on that. A lot of us use our mobiles anyway. But then we have this situation where, you know, if the NDIA call you, they call you to tell you that they've called you and you can't call them back. And you've only got a first name and you don't even have sort of an ID number. You can't let them know, look, I'm sorry, I've actually got a life. I'm busy today, but I would be available. Well, you haven't answered your phone, you know.
One of the most important things to a person with a disability is accessibility. And the most inaccessible government agency of all time is the NDIA.
Yeah.
It is a total contradiction.
So what does that mean? Apart from you can't ring up and talk to anybody, that doesn't help.
You can't ring up and talk to anybody. You can't email anybody. Right. You can call a 1-800
So you send everything
number.
to inquiries at NDIS. There's this big bin. I have offered to, you know, when you send in all your reports and they've lost them, It's only because we've only got a 10 meg capacity. So you go, okay, well, I'll send in 15 different little things like this, and then they don't get them again. So then I've gone into, people think there's a Centrelink, there's an NDIS office there. No, we don't actually deal with those people, do we? They're people that are...
They're hosted in our office, but you can't actually talk to them.
No.
Yes.
So then I've actually offered to train pigeons to scout them and find them to take the reports, with a little chip on the ankle there, send it off,
I think you should chip on the shoulder.
and hope the pigeon doesn't shed. But that would be terrible. So it is very inaccessible, and it is very hard for people to read and understand their plans. And there's a lot of...
It's worse than that. I mean, the plans... I've been a global leader in my industry. I'm not stupid, but I can't read some of the material that they produce. It's just incomprehensible. But imagine this. You've got a person who has a disorder that means that they're unable to communicate with people on the telephone.
Oh, you're buggered.
So the NDIA brings up the mobile number that they've been given. The person uses the mobile phone for texting. They can text. They can't talk on the mobile phone. But the NDIA ignores the instruction to text only and rings up. And then when you don't answer the phone 3 times, they cancel your request because you were unavailable.
Oh, is that what's been happening? Oh.
No, yeah.
Oh, okay.
Oh, yeah, you got to love it.
I thought it was just me. I thought it was just my name at the bottom of the email. I feel better now. Okay, so what I wanted to mention about was augmentative communication. So when you have a participant who has difficulty communicating and you are you're a support staff member, you're not their nominee. You're not their guardian, you're not their spouse, their parent, their anybody else. You're just there to assist them with communication. You are a piece of organic assistive technology, a bit like a Toby, only I'm a Claire. So that doesn't mean that I have any veto. I facsimile say exactly what they're saying. And that is not something that the NDIS recognises, and I find that really difficult. They don't. It's like, no, I'm not there. Oh, you have to sign a form. No, I'm a proxy. I'm just going to translate what they're saying, or they'll say it to me, or it might be for psychosocial reasons. It might be because they're hard to understand. There might be a whole host of reasons why. They might not feel like talking to the NDIS because it makes them unhappy. I don't know. There might be, it might be time for the shallow and pointless, the bold and the beautiful in the afternoons, and they want to watch that. But there's no service for that. There's no service for in hospitals as well for that. There's no sort of MOU between the NDIS and health.
It's ridiculous.
And yet 90% of people with the disability aren't on the NDIS.
So one of my experiences as a consultant to organisations using technology, and I've worked with some of Australia's biggest companies and some very big companies globally, organisational change that leverages technology involves people, the work that they do, the structure and rules in which they operate, and the technology that they use. The Australian government, and in fact most Australian state governments, have this mindless focus on the technology, and they ignore all of the other things, and they just expect that change to be driven by the technology. And that's why you don't get effective system change in Australia, because they don't work on changing the system. They just work on spending millions and millions of dollars on SAP and so on, technology companies, because somebody put an arm around a politician and said, there, don't worry about this, we'll look after it for you.
So it's a bit like having telemarketers with a script. They thought that they could turn their people into that.
Oh, yes. Absolutely.
Because that's quite the issue. I felt that was the problem with Qantas, during COVID. They sort of sent everybody home, we're going to save a heap of money, go home, gardening leave. And then they just wondered where all their expertise, where all their resources, where all the value in their staff went. And that is the same thing in the workforce across the NDIS for the support staff, it is for the support coordinators, for the planners. I've heard it's a really hostile and toxic environment in at the NDIS and the NDIA.
I've been talking with a person who joined the NDIA earlier this year in a frontline role, who spoke up to the supervisor saying, the system's producing bad results. So the person was put on a performance improvement plan because clearly it wasn't appropriate to report that the system was producing bad results. It was important to reinforce the bad results and not care about the person with a disability. The person has now been drummed out of the NDIA.
Yeah, and I do feel for people working there. You do come across some good souls who sound as frustrated as everybody else.
Yep.
And we are all part of the same team, from the support staff to the NDIA planners to, you know, even some of the ministers. We are part of a team, and there's a lot of stress on a lot of people's faces.
But then I've spoken to ex-NDIA people who were planners and you know, roles like that, who say, I can't tell you anything about my experience in the organisation because I've signed an agreement that says that if I disclose anything at all about the time that I was working there, I will be prosecuted for breaching the agreement. So the NDIA has put in place layer upon layer upon layer of mechanisms to keep secret the things that we need to know so that we can actually get the system fixed.
There are changes coming regarding whistleblowing, is there not?
Yeah, I can hear a faint whistle in the distance, but I won't trust that until it's actually arrived.
So the AAT though, they're rolling that up. And shoving that in the bottom drawer. So isn't it all over now?
No. What's
and we're going to have this massive review. And Captain Obvious the other day, you know, at the press club said, you know, oh well, you know, it ain't. You know, we've lost our way, and we.
No, what's happened about that? There's an issues paper that's been recently released in April, and I've actually been approached by one of the committee members appointed by the Attorney General to put in a submission, and I've started it. It's due mid-May, and basically what I will be arguing, what the submission will be about, is what the new agency should look like. You know, the problems with the AAT as it is, and what the new agency should look like.
Agency as in NDIA?
No. The agency, to replace the AAT.
Yeah.
So the changes will be, there'll be a proper merit selection process. People will be interviewed on merit. Everyone has to reapply for their job. The people there currently that are not properly qualified will not be reappointed. So all that's going on as we speak. So my understanding is certainly in the second half of the year we should start, you know, transitioning to the new agency to replace the AAT, is my understanding.
But that only fixes the appeals process. Fixing the NDIA itself.
Well, that's only sort of finding a different way of fishing them out the river. It doesn't stop them from falling in.
Yeah, stopping them from being thrown in the river.
Thrown, yeah.
Yeah, that's a much bigger job. And so, as I said, we've got this layers of obstruction to prevent people from accessing the real information. And the same thing existed with robo-debt. And so, you know, the Attorney General did investigations around robo-debt and didn't find anything actionable because people hid it from them intentionally. They broke the law on that too. The same thing is happening with NDIA. You cannot find any information about how the algorithms work. And some people say there are no algorithms, but we know that there are algorithms. We've actually got data capture forms for one aspect of plans that they accidentally released to somebody in an FOI. And we know that they're tipping data into these massive algorithms, and those algorithms are producing bad results. So this particular person, quite fascinatingly, the algorithm produced a result where the NDIA then told the person with disability that she has to leave her partner of 31 years and go and live in a group home with 3 other people that she's never met in her life.
There's a lot of that going
where
on.
this group home is less well adapted to her disabilities.
Because she'll be cheaper? Because they can share the support workers?
Well,
if they
something
turn
like
up?
that. Yeah, something like that. But the getting to the nub of exactly how the NDIA operates, they have these cases that lock everything up. The only way to unlock them is with something that has the power of a royal commission or a court.
Well, we've just had a Royal Commission into disability.
Yeah, the Royal
We haven't got
Commission
the
into
results from that
disability.
one. We're flipping the wheel around. We've got one on Veterans Affairs. We're doing disability, and we did aged care. I mean, that seemed to do bugger all.
They do bugger all, because the terms of reference for those Royal Commissions are vague and general, and focused on the top layer. The Royal Commission into disability is not able to investigate the details of how the NDIA operates. That's out of scope. You can look at the terms of reference, at the letters patent, they're called, and there is nothing in there at all that gives them the power to investigate the deep internals of the NDIA. It's about the surface layers and across the whole spectrum. So the NDIA is one little bit. Group homes is another little bit. Education is another little bit. There's all these little bits, and it's taking forever.
Oh, yeah, they did SRFs and they did SDA and they did SIL and they did...
So it's not getting to the nub of it. And nor did any of the investigations into Robodebt until it became a Royal Commission. And it became a Royal Commission. Why? Because the government wanted to be able to nail the previous government for doing the wrong thing. It's extraordinary that here is another opportunity for the current government to nail the previous government for extreme bad behaviour towards the most vulnerable people in the nation. And they're not doing it. They're not resisting us, but they're not doing anything to advance the cause. They seem to be waiting for us to build up the undeniable case to do it.
I would like to see them at least support the class action for people to... I don't think you can have accountability without consequences.
Well, exactly.
And unless you're going to give people smack bottoms, I think that you really do actually, there have to be consequences.
And interestingly, when we looked at the Robodebt, there was the class action and then the Royal Commission, because the class action, which was extremely hard to get up, and I'm led to believe there were 3 failed attempts at it, provided enough of the proof that the Royal Commission then went ahead. But if you do the Royal Commission first, you get the proof out on the table very quickly. I mean, the Robodebt Royal Commission has been extraordinarily fast in the history of Royal Commissions in Australia. And not only has it been extraordinarily fast...
It was very good.
But it's really revealed the extent and the depth of misbehaviour in the government.
So it was fit for purpose. It did a good job.
Yep.
It was.
And I think that report's going to be a good read.
And we've asked the Royal Commissioner to recommend extending her Royal Commission to cover Robodebt as well. She's responded saying basically she's really interested in the problem, but she doesn't think that it's appropriate to recommend that her Royal Commission be extended. Okay,
Fair enough.
She can't recommend extending her Royal Commission, but she doesn't say that we can't petition for another one. And so that's what we're working to, is a petition for a Royal
What the
Commission.
issue here is looking at is because we're going to have a review or a reboot or a rehash or whatever it's going to be. This this thing where everyone's sending in recommendations.
Mm-hmm.
I reckon everyone should get a smiley face sticker when they get signed up to the NDIS, whatever it is they want, right? And then magically that's all going to come out with a conclusion and everything will be grand.
The current review won't do anything.
Well, we have workforce failure for a start. That's a bit of that is a bit of an issue.
It'll tackle a few of the surface issues, but none of the reviews that are currently in train will ever look at the depth of the problem of the mechanised planning.
To me, it is like looking at little pixels every time we do a Royal Commission, and we are not looking at the picture. And I think at some point, and I think, Karen, you touched on that by talking about Royal Commissions into public service, maybe we need to change the way we do it. I mean, there are, some other countries that do it better than us. There are other countries that don't and have, places where, chop, chop, square every Friday, that sort of thing. And of course, we don't want that. But corruption in Australian government was something that I never thought I'd hear in the same sentence in my life. I've always had a great deal of respect. And I am quite shocked.
It doesn't deserve
the
respect.
The degree of incompetence, but the level of pain and that it has caused, but the consequences shortened people's lives and done them harm and their family members harm. I mean, you must be concerned for your son if something should, and touch nothing ever does, but if something happens to you, then what?
Exactly. We have a member in the group who is an over 70s mother of a middle-aged person with a disability who asked for a plan to enable starting to set up the person with a disability for life after mother is unable to support. The NDIA said no, because you're perfectly capable of providing the support that she needs. Huh? It's not supposed to depend on the parents. The parents are not supposed to be required to live to 170 years old in order to support.
Well, you've got children of participants trying to support their mums and dads as well. There's some very, very painful, woeful situations
very
that
dreadful.
are not very first world and not very, dare I say it, Australian.
Yeah, exactly. So what we're doing about this.
Yeah.
Now, you said that Royal Commissions are looking at pixels. There's a big dilemma. How do you eat an elephant? One bite at a time. Okay. There are massive problems in the Australian public service, and we can't tackle all of them at once. What we can tackle is one little bit that turns out probably exactly the same as another bit that's already been tackled. Okay. We've eaten the robo-debt pixel, and it tasted really awful. And now we want somebody to eat the robo NDIS pixel, because we know that it's going to taste just as awful. So we've shifted our focus from asking for a class action to asking for a Royal Commission.
So you're not going to do that now?
We'll do the class action after the Royal Commission.
Okay. So if people do want to share, then you'll give a website where they can contact you?
We have. So we launched a website for the Royal Commission campaign just over a week ago. So robondis.org.
Okay. And
depending on what software you're using on your computer, you might have to put www in the front of it to get there. So www.robondis.org ndia.org will get you onto the website that we've set up. And there's a fantastic picture of my son on the front page. But then behind that, there are dozens of short clips of stories and a few longer stories of people that have been suffering at the hands of the NDIS. There is details of how we're running the campaign, and there are links to sign up onto what is effectively a mailing list so that we can update you on how we're going. To get the Parliament to answer the question of can we please have a royal commission, we have to submit a petition.
Right.
And in Australia, there are only two ways to get a petition to government. You either have to go through the ages-old process of a paper petition, getting people to physically sign it, which can take months, or you do an electronic petition, which you can only do on the government petition website. And that electronic petition can only run for 4 weeks. It's designed to prevent petitions from being successful. So what we're doing is enrolling people in the pre-petition process so that when we get the right numbers, we can drop the flag and say, okay, people, for the next 28 days, the petition itself is open, go and sign it.
Ready, set, then go.
Ready, set, go. Okay. And we're hoping to get 1 million signatures.
Okay. So for people can go on there, and if they need any help, is there a number for someone to call, or is there anything like that on there?
There are contact details.
Yep.
We're trying to avoid phone numbers because we're all volunteers. We're all incredibly flat out, just making the system work. And we have to ask people to remember that this is not a help, how do I solve my problem with the NDIS? There are other places.
This is not a place for peer support. Okay.
This is not a place for peer support. You can go to...
So if you can get to the robondis.org site, you can sign up ready in time so that we can all sign up in that 4-week period.
That's right.
So it's like a portal that only opens, and we've got to wait till it's open and then jump through in the last minute.
That's what the last petition step is. Yeah, right. It's a magic box that opens and then snaps shut 28 days later. So we don't think that we can get quite the numbers up in 28 days without doing some preliminary build-ups.
Okay, so this is a way of people just being able to add to some support. So where do you recommend people go that if they need to have peer support or reach out, or they want to tell their story, or they need help?
So if you are a person who has suffered from the NDIS's bad behaviour, we have a companion Facebook group, which is the one that we originally set up. That Facebook group is called NDIS Class Action and Royal Commission. There is a gateway on that. You have to explain why you want to join the group before you'll be given access to it. But once you're in there, you can tell your story.
And it doesn't matter who you are. You can be a participant, a parent, a friend,
support provider, friends.
If it hurts you, everyone's welcome.
Yeah, that's right. If it hurts you, if you're experiencing, or somebody you know is experiencing harm caused by the NDIA's behaviour, you will get in.
Yeah.
For other people who have other challenges with the system, there are a lot of well-established Facebook groups. Just search for NDIS groups on Facebook.
Yeah. If anybody's in really difficult situation and it's and they're suffering, you're also welcome to give me a call on my 1-800 number, which Rory will put up on the screen later, won't you, Rory? He says yes.
Good on you,
because
Rory.
A lot of us are volunteering and providing actually hands-on sometimes as well, because they're just aren't that many people to go around. It really has been a wonderful community experience from that. Everyone, a lot of people have come together to support each other and help each other.
Yeah.
Yeah. So in your situation, where are you at with your UFO? I mean, FOI. You,
Well, I've referred the letter I got today to a barrister who's is an ICAC barrister,
yeah.
and seeking her advice. And the fight continues.
So if you want information about yourself, you can't just go in and go, can I have that correspondence we had?
Well, as I say, they're not denying that it exists, but they want to protect people's names and identities, and that flies in the face of the
accountability.
It's not. And I'm very interested to hear what you said earlier about what the Prime Minister has said about all of this. So that might be useful in my response, actually.
Well, he's also having a chat today about telling the states that they're going to have to pull their socks up.
Mm-hmm.
See, mine are very high today. Look.
Oh, excellent. Yes.
I've got, it says, no drama llama socks.
No drama llama.
Baby llama don't like no drama. It was either them or the easy peasy lemon squeezy. But that's what we went for. Thank you for coming, and I hope that it continues to go forward, and that you have some success, and that the people can come together and they'll decide.
Yep. Well, if everybody who's tuning into this just dives onto that website, www.robondis.org, don't make the mistake of putting .com. You won't get anything. Put .org, and join us in the fight.